Hello ladies, gentlemen, boys, girls, innies, outies and in-betweeners. My name's Dan and welcome back to another PAP Reports. Today is Monday, April the 13th, 2020. I hope you had a good weekend. Today we've got a short video, which is good considering the content of most reports. And we're starting today with more evidence of police not adhering to their own COVID-19 operational guidelines. On Saturday the 11th of April, I uploaded a video explaining the National Police Chief Council operational guidelines for police to keep themselves safe whilst on duty. In that guidance it tells the police that double crewing, it is recommended that PPE, minimum of a fluid resistant surgical mask and gloves, non-latex, should be readily available for officers where it is necessary to deploy double crewed patrols or in personnel carriers, meat wagons. In the circumstances where close contact with the public is likely and social distancing is not available and possible risk of infection exists, it is recommended that officer and staff wear a fluid-resistant surgical mask and gloves. Furthermore, that they conduct a risk assessment on use of goggles and an apron. And also in the circumstances where close contact with the public is likely and social distancing not available and symptomatic, it is recommended that officers and staff wear a fluid-resistant surgical mask, gloves, disposable aprons, goggles. Furthermore, that they conduct a risk assessment on the use of fluid-repellent coverall or oversuit. But yet again, the people who are most likely to spread the infection, in my opinion, are ignoring their own operational guidance. Isn't it funny how police guidance can be followed or ignored without penalty, but guidance to the public is enforced? On Saturday night, April the 11th, police attended an incident in Hardwick, Stockton on Tees, where they are said to have noticed what looked like an altercation in the street. One of the men in the suspected altercation is then said to have become ill and required medical attention. Now, I've yet been unable to find out exactly why the police were there in the first place, but as we have seen recently with what seems to be nothing else going on, the police are prowling the streets in packs, and in this case 20 police constables attended the scene after paramedics arrived and police called for backup due to people standing around watching the incident unfold. The mainstream media are adding their 2 cents worth in their reports about social distancing rules, but there's no indication that people were not in fact adhering to the rule. They were in the street and could easily have been more than 2 metres apart as no fines were issued, but 20 police in total attended, literally clambering on top of each other and completely ignoring the government advice and their own operational guidance. Now, as I've said in previous videos, the police are not exempt from rules no matter what many of them may think, and with so many of them not wearing PPE, they're becoming a danger to the public. We should understand that in some certain cases it's impossible for them to have the time to put on their PPE, for example if they stumble across an incident, but there's no excuse if they're on a shout and control room has had a call and they've been deployed there. If you're stopped by the police and they're not wearing PPE, make sure you do what you can to keep them at a safe distance. You have to protect yourself. It seems to me that many police seem to think that they're immune, but that doesn't mean that they should be putting the public at risk. And I think that it shouldn't be guidance, it should be policy for them to wear gloves and masks at this time, in my opinion. As an example of my point, this video was shared on Facebook at the weekend. Now, I'm not taking away the fact that they were praising the NHS, but with the message anyone can get it, anyone can spread it. Save the NHS, and other comments like it's selfish on an already stretched NHS. Who are these clowns to tell us what to do when they're not doing it themselves? A study into the deaths in Italy from coronavirus seems to have been a fruitful endeavour. A study into 355 deaths has found that only 3, that's 0.8%, would seem to have actually died from COVID-19, where 99.2 had other underlying problems which may have been exacerbated by coronavirus, but are not confirmed to have died from it. Almost half of the deaths looked into in the study had 3 or more pre-existing health conditions before they were infected. Just over a quarter of those who died had 2 underlying health conditions, and the other quarter had one underlying health condition. The study carried out by Italy's National Institute of Health has shown striking similarities with previous findings, showing that people with existing health conditions are the most at risk. In fact, over 76% of those who have allegedly died from COVID-19 previously had problems with high arterial blood pressure. 33.5% had diabetes and 33% suffered from heart disease. 24.5% had suffered from arterial fibrillation. So although it seems that those with high blood pressure are most at risk, scientists are not yet able to establish why. It's said that in the UK there are around 15 million people living with high blood pressure, while in the USA over 100 million people live with the condition. High blood pressure here in the UK costs the NHS over £2 billion every year. Now, if I had a tinfoil hat, I could suggest that the cull of all these people would just save the country billions and would be a hell of a burden lifted from the NHS. According to a study in the journal Immunology Research, high blood pressure causes low-level damage to the inside of blood vessels, and the damage stimulates a small response from the immune system, meaning that when it has to respond to a real threat like a viral infection, there is greater risk of it overreacting. Immune overreaction can lead to sepsis, blood poisoning or organ failure, which are all fatal and are known to be the cause of death among coronavirus patients. There is no research published on that yet though, and it's believed that hypertension could be an important factor in causing patients to deteriorate, leading to a bad prognosis. The Italian study also found the average age of people who died from the virus in Italy was 79.5, although it was slightly higher for women than it was for men. Italy's National Research Council says it expects a significant reduction in the growth rate of new infections in the Lombardy region by next Tuesday or Wednesday. The northern region of around 10 million people has been at the epicentre of the crisis since the start, reporting 2/3 of all the deaths in a nation of 60 million. It's been on lockdown since March the 8th. And noting that infections are starting to rise in the south, where many Italians moved after the start of containment measures in the north started, the National Research Council predicts that figures across Italy will only stabilise between March 25th and April 15th. And I want to finish this video with a video that was sent to me last night. A woman who claims to have a loved one in hospital in his final hours. She's said to have asked the nursing staff if they could be put in a private room to spend the final moments together, but was denied. She then went on to film this short video.
Rooms here. This is the coronavirus unit. My dad hasn't got long to live. They told me he's only got a few hours left. I've asked them to move him to one of these rooms so I can spend some more time with him. But instead they want me to stay in that room with the other corona patients. Empty. Just do not understand. Where the ward that my dad's in, there's 3 patients at the moment and my dad the 4th patient. I've asked them to please put us in another room so I could spend his final hours with him. And they say no. Empty. No one around.
Now, trying to be balanced, I will say that this could be a hospital that's not got a lot of coronavirus patients, although on the other hand, it seems that where there's one, there's many. So when you see this, it may well give you something to think about. It's also clearly not an old video. She's talking about COVID-19, which isn't something someone would have had the forethought to have done, in my opinion. And for those of you who might be asking why she's walking around when a loved one is so ill, I can't answer that. I don't know. But again, trying to be balanced, it could well be that the person was asleep. It's also a little weird that she talks about spending time with the loved one when we have all been told that relatives are not allowed to visit COVID-19 patients. And that's just me trying to be on the level with you. Big thank you to Patreon supporters AD Audrey, Carl Copwatch UK, Danielle, Dave, Dean, Holly, Ian, Jay, Marty Ladd, Mr Beaner, President Trump, Peter and Rich. Now don't worry, I won't be reading them all out all the time if I get any more, but I will still recognise those supporting the channel through Patreon by putting your names on screen as a thank you for your support, as it helps me to continue bringing this content. Anyway, that is all I have for you today, believe it or not. Please like, share, comment and subscribe. Let me know your thoughts, as I know many of you will. Until next time, stay safe, look after each other, film the police, and of course, other officials.
Good night, all.
Thank you for taking the time to watch this video. If you like the content and you'd like to help support the channel, you can do so. In the description of every video, there are some links to ways that you're able to help support the channel so I can continue putting out content. If you're unable to help us in that way, hit that subscribe button up the top there. If you haven't already, become a subscriber. That is support enough. Share the videos, comment, like, it all helps. If you're looking for something else to watch, up top there is my latest video. Down the bottom there is a video that YouTube recommends for you.